So welcome everyone. Hello, my name is Jessica from the Career Center, and today you are here for Resumes for Healthcare. And we are so lucky to have Addie Black from A Bridge to Achievement leading this meetup. She's an alum, so go Niners. She knows what it
Yes.
feels like to be a student at UNC Charlotte. And she is a regular at our events at career fairs and things like that. So you will see her face often, and she is truly a genuine person. So Addie, go ahead and take it away.
Thank you so much, Jessica. Such a pleasure to be here. I led this career meetup last year and it was wonderful. So I'm just thankful for the opportunity to come back. But yes, I went to UNC Charlotte. Love everything about UNC Charlotte. So I love getting to do these and be on campus at career fairs and everything too. So yeah, thank you so much for having me. I will go ahead and share my screen and we will get started. See if I can have this pulled up too. Perfect. Can you guys see my screen? Perfect. Awesome. Well, welcome everybody. Happy Monday. I hope you had a great weekend and enjoyed the wonderful weather that we had. I definitely was outside and hanging with some friends, so my allergies don't love it, but that's okay. But today I'm going to be kind of just talking about resumes 101, and kind of the basic stuff that you need to have in your resume. Um, and so I've got a little presentation here today. I'm going to introduce myself and my agency as well, give you some background into what I really do and what we do as well. So my name is Addie. I am the recruiting and marketing supervisor for A Bridge to Achievement. And just a little bit about me, I graduated from UNC Charlotte with a degree in psychology. I have been in the field of ABA, or Applied Behavioral Analysis, for 5 years. I started out as an RBT. I still am an RBT. My certification is still current. However, our RBTs and BTs are the ones who do the direct one-on-one therapy with our learners. And I will get into our company's background a little bit as well and kind of give you some insight as to what we do. But we do applied behavior analysis services with individuals with autism. And so I've been with my company for about 5 years as well, going on 5. I started out as an RBT. I did direct therapy for about a year. That was before we even had a center in Charlotte, and now we have 2. We have one located in Pineville, and we have one located in University City, about 5 minutes from campus as well. So I did direct therapy, and then once we opened up our first center, I was the center coordinator, and then center supervisor, so supervising all the kind of administrative duties in the center. I have been in my current position though, kind of transitioned out of that into recruiting, into some HR as well, some documentation, a lot of stuff with our auditing purposes and things like that. But now I handle all recruiting and marketing initiatives. So that means all the career fairs. We are at every career fair pretty much at UNC Charlotte, and then also any universities in the North Carolina system as well. And with marketing, we have some really exciting initiatives coming up this year. We just posted our first TikTok on Friday. And so at the end of this presentation, I'll kind of give some QR codes to our social medias because I would love to get connected with you all. LinkedIn, Facebook, all of that stuff. And yeah, you are more than free to shoot me a message as well. I did this last year. If you have any specific questions about your resume, I am more than happy to look at them for you. My expertise is in psychology, the mental health field as well, but I've got some resume examples in here too from different positions like nursing, medical sales, and stuff like that too. But yeah, so that's a little bit about me. I'm also from Charlotte too, pretty much. I've been here since first grade, I think. So I wasn't born here. I was born in Pensacola, Florida. My dad was in the Navy, so we moved all around, but then kind of settled in Charlotte, and I've been here ever since. My family lives in South Carolina. My parents live in Lexington, about 20 minutes from Columbia. My older brother is a chiropractor. He lives in Greenville, South Carolina. And then my little brother is a senior at Clemson. So he'll be graduating this year. He wants to do pre-med as well. He took the MCAT, all of that crazy stuff this year and stuff. So he's about to enter the workforce as well, and probably go to med school and all of that stuff too. So it's just a little bit about me and my family, my background. So about our company, so our president and CEO, Dana Alley, she experienced firsthand how ABA transformed the life of her son with autism. So she actually has two children that are on the spectrum. Her daughter had a later diagnosis, but her son had ABA on in his life from a very early age. And so she really dedicated herself to advocating for the services to help her son achieve his full potential. And in doing so, she built a diverse network of supports that she now shares with families facing similar challenges. So we provide ABA therapy to children with autism. 2 to 21 is our range that we serve. However, if insurance authorizes it, we can serve up to 26, which is really amazing. My cousin has autism and he is 24. I think he just turned 24. So I've definitely seen firsthand, how it can be challenging once they kind of get to that age, making sure that they receive the support and resources that they need. So being able to serve up to 26 is just fantastic. So we really try to positively impact the lives of the learners on the autism spectrum by unlocking their highest potential and creating significant, meaningful, and lifelong changes. We partner with caregivers and other, therapeutic avenues as well, to really understand learners, identifying their strengths, interests, and learning styles. Our highly trained behavior analysts and registered behavior technicians, or behavior technicians as well, use individualized, evidence-based applied behavioral analysis practices to deliver focused, comprehensive, and early intervention services. So I know this is a lot of words, and I remember when I was in school, I stumbled into the field of ABA, didn't really know what it was, but I fell in love with the field and I don't think I'll ever leave. So I'll kind of give you some examples, kind of my little spiel that I say at career fairs as well, to kind of give some insight as to what we really do. So ABA studies how behavior works, how behavior is affected by the environment, and how learning takes place in different learning styles. So our company, we operate on the least restrictive environment, assent-based practices as well, and trauma-assumed care. So these all go hand in hand. You can't have one without the other. And assent can be withdrawn at any time, and we honor that, whether our learners be, speaking or non-speaking, really understanding them, reading their body language, making sure that they really want to participate in whatever we're doing in session. So the same principles that we use with our learners and families, we also use with our staff. So we really strive to create an environment where everyone feels seen, valued, heard, and an environment that you enjoy coming to work every day. We know that this field isn't always an easy field. And also the healthcare in general, we know that burnout can be very prevalent in any field where you are helping take care and work alongside other individuals. So we try to support our staff and families as best as we can. And I think our benefits package too really reflects that on the staff side of things. But to kind of give you an example of what ABA kind of looks like, we always say if you've met one individual with autism, you've met one individual with autism. They are all so different, just like all of us. And so I can't tell you what one direct therapy session is going to look like, but I can give you some common things that we work on. So usually the first thing that we tackle when we get learners who maybe they are non-speaking is we tackle functional communication training, whatever that looks like for them. So some learners may come to us with an electronic talking system. We can help them learn how to use that more efficiently. We can implement some sign language. We can also implement something called a PEC system, which is a picture exchange communication system. So that's usually what we tackle first. And then we've got an early learner program as well, kind of like a kindergarten readiness program, a lot of following schedules, following routines, like we got to go to recess at a certain time. We got to go to the lunchroom at a certain time. We practice, lining up, taking turns, different line leaders, different things like that. And it's a really, really awesome program. We also have a older learner program. And it is so cool. We actually just launched it at our University City location. We simply just didn't have the space in our Pineville location, which is I guess, a good problem to have, but we are so excited that that has now been launched in university because it's been really developed in Winston-Salem. And I don't know if I mentioned this before, but we have 3 centers, one in Winston, one in Pineville, and one in University City. So in that older learner program, it's a lot of increasing independence. We kind of refer to it as our ADL program because it is a lot of those activities of daily living skills. We always say our ultimate goal is to put ourselves out of a job. We don't want our learners to need us. We want them to be independent. So we do a lot of really cool things. For instance, we have a mock bedroom so we can learn how to make our bed in the morning. We've also got a clothes rack so we can learn how to, button our shirts. We've got a full kitchen as well so we can help our learners learn how to make meals for themselves. I was at our Winston-Salem Center last week and I got to take I was doing a lot of marketing, taking pictures for our website, for our magazines that we put out quarterly for our families. The magazines are really cool. We will send them out to families of the learners who participate in our early learner or older learner program, give them a lot of insight as to what we did this quarter, specific things that we're launching in the program. And so I got to see some learners in our Winston location make meals for themselves. It's a lot of social skills as well. And it's just amazing. So a lot of cool stuff. There's also like different bins in our early learner or our older learner program with specific things that they may want to work on. So like reading expiration dates on different foods and things in their fridge or different things like that. So I always sing our program supervisors praises because they think of just the coolest things that our learners might need to work on. So that's kind of a roundabout answer of what we do because I can't tell you exactly what one session looks like because they are also different and we do specialize in individualizing each program curated specifically for each learner's needs. So that's just a little bit about our company, kind of what we do. And now we'll kind of jump into what we're all here for, resumes in the healthcare industry. So my main goal today is I want to really help alleviate some stress when it comes to developing your resume. I remember when I was in your shoes, I heard a lot of, you need this, you don't need that, make sure to include this, if you don't do that, that's, this whole thing. And it stressed me out, frankly, and I was kind of confused on, what I needed, what I didn't need. And so today I really want you to understand that there's not necessarily a right or wrong way to do your resume, just as long as you have your necessary skills and qualifications showcased in your resume and the fact that you tailor your resume for each specific job that you apply for. And I'll kind of get into that a little bit more as we go through this presentation. And my area of expertise is psychology and mental health care. So if you've got any questions related to that, I can definitely, help with that as well. And then I've got a lot of friends in the healthcare industry as well. So if I can't answer it for you, I'm sure I can find somebody who can. So first up, your personal info, your heading. So make sure to include your name, your address. You can kind of also just put like Charlotte, North Carolina, or wherever you're located if you don't want to put your specific address on there. But for instance, for our company, I do need to see your address because that does determine which center location you would be slated for. So address, phone, email, LinkedIn as well, just your personal information. Some people do put a summary or objective on their resumes, and that is totally fine as well. However, I would recommend keeping that between 1 to 3 sentences long. Like I think I had one on mine that was like, I am a experienced registered behavior technician. I'm not looking for job opportunities right now, but if I was, I would say, I have a lot of expertise in data collection, mental health care, etc. So don't feel like it's necessary to put in there, but if you want to put it in there to kind of showcase, who you are and what you're looking for, that is more than okay. But just keep it between 1 to 3 sentences long. So next up is education. So definitely include your degree, your date of graduation or anticipated graduation date, the institution or university that you obtained it from, and then also any relevant courses. So maybe you aren't done with it yet. That's totally fine. We have staff who come work with us for the summer or whatever it may be. Definitely put any relevant courses. Like I took a applied behavioral analysis course in college, so I put that on there. I think I also did like childhood development course, different things like that. Anything pertaining to whatever job you are applying for, definitely stick that in there. And then GPA is optional. However, if you've got a stellar GPA, definitely stick it on there. But don't feel that as if you have to. If it's not the best GPA, that's totally okay. I will be the first to say I didn't have a wonderful GPA, but that's okay. I definitely switched my major 3 or 4 times. So if you got a great GPA, definitely stick it on there, but don't stress too much if you don't. Just having that completed degree is wonderful. So education, professional experience. So any and all experience related to that job. So work, internships, classes, volunteering, etc. I had a internship through my capstone course in psychology where I volunteered at a um, mental health facility. So I stuck that on there for how long I did it. But the dates that you worked there, your position or your title. I was just an intern. And then I also, let's see, what did I do for volunteering? I volunteered at the Special Olympics. I also volunteered at the Ronald McDonald House. I also was a camp counselor for a few summers. So I put that on there too, because that's, dealing with children. I definitely had some children who were on the spectrum as well. So I highlighted that on there as well. Include the organization name or where you worked, and then your duties and responsibilities. But with duties and responsibilities, um, don't put a whole paragraph on there, this is not like an essay that you're writing. This is mainly just to highlight those main big pieces of your experience. So if you do put your duties and responsibilities on there, try to keep it as short as you can, but still highlighting every, relevant experience that you have in that position that would pertain to this position that you are applying to. So professional experience, also any certifications or licenses. So I have on mine, I'm a registered behavior technician. I'm also CPR and first aid certified. I'm also CPAI certified, which is our crisis prevention and intervention training. That's our own certification, but it's recognized through the state. And then any licenses. So, CNA, RN, etc. Any certifications or licenses that you have, definitely stick that on there under this section. And then skills and activities, any proficient skills that you have, Microsoft Word, Excel, etc. Also languages. So if you are bilingual, if you're fluent in Spanish, French, etc., definitely stick that on there. That's an amazing skill to have. I wish I had that for sure, but that definitely helps make your resume stick out a little bit more if you are, bilingual or trilingual or whatever it may be. So any skills or activities, stick those under there. And I also want to note that all of these sections that I kind of just went over are interchangeable. You can combine them, keep them separate, all depending on how much information you have for each. So let's say I was bilingual and I am an RBT, but that's really all I have for both of these. I could combine those sections and just make like certifications and skills or something like that, So these are kind of interchangeable, but it's just dependent on how much information you have for each. So don't feel like if you have one skill, just to have one thing put under skills and activities, you can combine that with another section, just to make it look a little bit more beefy in that section, I guess, for lack of better words. So some tips and tricks for resumes. Don't get too bogged down with the technicalities. Focus on the main sections and what is included inside of each. And also tailor your resume to highlight specific experience that relates to the job that you are looking to apply to. So in a couple slides, I've got some resume examples from one of my friends who is, she's a nurse. She's a travel nurse, but she also was applying to some medical sales positions. And so I'll kind of show you the differences between those two resumes that she has developed. So as you go through your job hunt, you might find that you are creating different resumes for each, specific position that you apply for, and that's how it should be. You can have one main resume that's kind of like your basis to go off of, but I do recommend copying it, and making another resume for a nursing job or a RBT position or a medical sales, tailoring it specific for those specific jobs. Um, that'll help you a lot as you are applying for jobs. Cover letters show interest and make applications stand out. So I definitely recommend that. We do not require it for us, but it is optional. But I will say, when I get all the applications in and I see somebody who's got a cover letter, it definitely, kind of amps their application up just a little bit more because I see how involved and dedicated you are for this position or how interested you are. So cover letters are always a good option to make your application stand out a little bit more. Make sure to check for any typos to ensure professionalism when submitting. So this is a big one too. You'd be surprised about how many applications I get with numerous typos, all throughout it. And that kind of makes me feel like, okay, maybe this person really didn't, they don't really care about this position. They didn't really spend a lot of time proofreading their resume or their application. So just, proofread it, make sure that there's no typos in there, any grammar, things like that. Keep the format the same throughout your resume. So keep the font the same. You can switch up like the size of the text, like your name should be a little bit bigger than the other stuff on there. But make sure the format's the same and keep the same font. Put the most relevant information first. So in school, I definitely had my education put up at the top because that was my most recent and applicable experience to the positions that I was applying to. But now that I've been in the field for 5 years, if I were going to try to find a new job, which I'm not, but if I was, I would put my work experience a little bit higher just because that is more, I want the hiring manager, whoever it is, to see my experience first. I definitely still include my education on there, but the fact that I've been in the field of ABA for 5 years, my specific positions and my qualifications and job duties within each position, that's what I want a hiring manager to see first. I'll still have my education included on there, but I have kind of switched the layup of my resume since I've been in the field for 5 years. Keep your resume between 1 to 2 pages. If 2 pages, add a footer with your name and credentials and page numbers. So that's kind of like if you are applying in person, you want to make sure that your resume stays connected with your first page. And so make sure it's got your name, the page and everything on it. So just so that you know that they stick together, or staple it also as well. It's not gonna make or break, if you have 2 pages. I remember when I was in college, people would be like, fit it all on one page, and that stressed me out because I was like, I do have a lot of experience though, so keep it between 1 to 2 pages because again, this is not an essay, but don't stress yourself out if it is 2 pages. That's totally fine, but just keep it condensed. You don't want it to be, again, 3, 4, 5 pages. I can tell you that a lot of hiring managers, they probably get a lot of applications and they're most likely not going to read 5 pages of a resume. So keep it as condensed as possible and highlight those specific qualifications that you have, and keep it rather short. Definitely fluff up your resumes, and make it look really good. This is you showcasing, your experience and your qualifications. You want to make yourself look really good. But don't lie. Don't lie on your resume and say that you have years of this experience when you don't, because if you do go in for an interview, odds are they're going to ask you about that. And if you actually didn't do it and they've got experience in that, they're going to be able to tell that, you lied about that on your resume. So definitely fluff it up, make it look as great as possible, but don't lie, or be ready to be asked about whatever is on your resume. Um, yeah. So tips and tricks for resumes. Now I've got some examples for you guys. This is actually my resume. And so you see I've got my name up here. I've got my personal information, my LinkedIn, my email, my address, my phone number, just so they can get in contact with me if they are, wanting to move forward in the hiring process or ask me to come for an interview. I did put my education up here first. This is also my resume from last year when I did present this, and I was starting my master's in human resource management. However, I did have to put that on pause just because I am planning a wedding, getting married in October, and planning a wedding is a full-time job. So I have had to put my master's on hold. So obviously, if I was submitting this, I would take that off because that is not accurate. And I have not started that. So but you see my certifications are next. So you see my registered behavior technician, you see my CPR and first aid, my crisis prevention and intervention. And then I've got relevant professional experience. And again, you can put relevant professional experience or work experience or whatever you really want to put there. But you see my RBT experience from June 2019 to current. I provide clinic and house-based ABA services to clients with autism, implement behavioral therapy plans developed by board certified behavior analysts, can include to, but not limited to, social skills, ADLs, behavior reduction, functional communication. And then I collect data to monitor the progress with the learners' families and different things like that. So I've kept it pretty short, but really highlighting those main things that I do as an RBT. And yeah, so keep it short, don't include a whole essay because it needs to be, quick to kind of scan through. And I see, okay, RBT, data collection, behavioral therapy, ADLs, behavior reduction. So highlight the main points and don't put too much in there. Keep it pretty condensed. So I've got my internship on here too, with what I did when I was a senior. I put the dates. I put on here, I don't know why this is so small. I'm gonna open my browser just a little bit more if I can. But yeah, leading peer support groups, initiating lesson plans, monitoring computer and fitness rooms, developing relationships with the members, assisting in mealtime. I helped a lot with our members' job applications too. That was super cool. Paperwork, development of clients' social and mental goals. So in those 2 bullet points, you really have a good idea of what I did in that position. So again, highlight the main points. Don't put too much in there. Keep it rather condensed. I also was a nanny for 8 years. I put that on there. Overnight stays, part-time, full-time, weddings, parties, vacations, special needs children as well, age ranging from newborn to 15. Again, highlight those main points. Camp counselor as well. And then down here, I have community outreach. So all my volunteering, crisis pregnancy resource center, I did that as well. Vacation Bible school, room at the inn, Elevation Church. And yeah, so again, highlight the main points. Don't get too bogged down with all of the information. Make it easy to read and accessible for whatever hiring manager is looking at your resume. Don't make it an essay. Keep it rather condensed. But again, making sure you are highlighting your qualifications, your skills. And yeah. So this is my friend. She has the same name as me too, but she is a travel nurse. And she also was applying for some medical sales positions as well. So I've got both of her resumes on here. This was her, on the right is her registered nurse application resume. And this is her orthopedic sales representative candidate one. So You can, switch it up if you want to add like a cute color at the top, or, a little kind of heading. That's totally fine too. She on the left did her education, her key skills, her certifications on the side, and then did her professional experience on the right. That's totally fine too. So maybe if you do have a lot of information and you want to try to keep it on one page, this is totally fine to do it as well and kind of have two columns. More than okay. But then you see over here for her nursing resume, she has her bachelor's of science in nursing, and then all of her certifications as well. So I would say for a nursing position, this is a great way to showcase, your certifications, also, where you got your nursing degree from. She obviously had a fantastic GPA, so she stuck that on there. So again, if you've got a great GPA, stick it on there. Definitely to showcase that hiring manager that you did really well, in your studies. But again, if you don't have a great GPA, don't feel like you have to put it on there, and that's more than okay as well. So for her RN positions, she put triage on here, um, medication administering as well, assisting physicians with procedures. And she's done a lot of stuff, I know, just from her. So this is probably as condensed as she could get it, but it does showcase all of the things that she did in her RN position. But again, kind of keep it to a sentence or two, and do a bulleted list. There's nothing wrong with that. That's what I did too. um, but yeah, showcase any and all skills that you have in that position, all the things that you did. And then you see down here in her other positions, she kind of condensed it just a little bit, but really expanded on those positions where she really did do a lot. um, so yeah, she was a patient care technician on there as well. Registered nurse, travel position. Yeah, so I think this is a good difference of the different types of positions you might be applying to in healthcare, whether that be a registered behavior technician like me, or a medical sales representative, or a nurse. Um, they're all going to be a little bit different, and so remember just to tailor each resume to the specific position that you are applying to. I also have my mom's resume on here as well, because my mom is a nurse and she's been a nurse for years. Um, let's see, when did she start? 1989. 1989. And so people like my mom, she has years of experience, and we want to make sure that we are highlighting that. So hers is 2 pages, but you see down here at the bottom, she put her name and the page number as well. So for hers, she does have a little summary, which is amazing. She's got 30 years of experience and she really wants to highlight that. So she said, I'm an extremely versatile RN with over 30 years of experience. I excel at quick and accurate assessments, establishing priorities real time, all while giving compassionate care to patients and families. Highly motivated, friendly, hardworking, and passionate about equipping patients to improve their health through education. That's great. We have a really good understanding of my mom's experience, how long she's been in the field, the things that she specializes in. So again, if you want to put a little summary objective on there, go for it. I think that's awesome. You don't have to, but if you've got some things that you really want to kind of put a blanket statement up at the top that these hiring managers will see, stick it on there. And then she's got her certifications in education. So her RN license, it's current in South Carolina, her BCLS, ACLS, and then she also put where she received her nursing degree, and that was from Auburn in 1989. And then she's got her experience on here. So she currently works at a outpatient surgery in Columbia. She worked at the Arboretum Pediatrics. I don't know if you guys are familiar with that, but that's in Charlotte. That was also I went there until I was literally 21 and I couldn't go anymore. So I know all of those doctors and nurses there. They're just fantastic. But yeah, she worked there for 7, 8 years. Also an atrium, outpatient infusion center in Virginia. Again, my dad was in the Navy, so we were in Virginia. Pensacola, Florida, where I was born. Washington State, where my older brother was born, Stanford Hospital. So she's got all of her experience on here. Don't feel like you're going to have this much to put on your resume. Again, she's been in the field for 30 years. I don't even have this much either. But put all of your experience on there, a couple bulleted points for the main job duties that you did in that position, the things that you really want to highlight. And then down here at the bottom, she has her strengths. So she, the postpartum, antepartum, GYN surgery, immunizations, IVs, triage. She did bone triage for a while, oncology, patient family education, thorough compassionate care, critical thinking, sound decision making, and excellent communication skills. So her resume is fantastic. All of her experience. You've got a really good insight into who she is as an employee too, and the type of services that she provides. So some resources for resume help as well. Hire a Niner. They've got that resume approval tool, their career center. You guys are amazing. Also, LinkedIn has a resume builder. I use LinkedIn all the time. They've got like LinkedIn learning courses on there too. So definitely, if you don't have a LinkedIn, I would recommend creating one. There is a lot of helpful tools on there as you are looking for jobs. And I would say pretty much all recruiters are on LinkedIn. Maybe not all, but a good amount are. Also, YouTube or TikTok, I have definitely found some really great tips and tools and information to help tailor resumes. And also friends. So that's a huge one as well. If you've got, for instance, when I was getting into ABA, I knew somebody who was a year or two older than me, who was in the field already. I had her check out my resume, make sure that there wasn't anything else that I should put on there, or just had her check it out. That's awesome. People in classes or people that you know or people that are in the field, definitely ask them to check your resume out, and see if there's anything else that they think that you should put on there, because they've been in the field, they know what the hiring managers are looking for. So definitely utilize your friends, or other people in the community as well. Any questions? That was a lot of information, but any questions or anything that you guys have? Totally okay if not as well. On the next slide, I am going to give our socials and everything and my LinkedIn. So if you do have some specific questions, maybe you don't want to say it out loud, that's totally fine. Feel free to shoot me a message. You can attach your resume. I did that last year, and honestly, a few people messaged me and they sent me their resumes to look at, and they looked great. So I didn't really have um, too much advice to give, but I'm more than happy to check it out if you want me to. And I'll go ahead and just click over to the next slide.
And Addie, I know that you work in a specific area of healthcare, but if a student was not in that specific area, is it okay if they ask you questions as well?
Totally, absolutely. And I do have a lot of friends who are in just the general healthcare, field. Again, my expertise is in psychology, mental health care, childcare. And so if I am not sure how to answer the question, or if I don't feel like I'm the best person, I can definitely reach out to some of my friends to see if they might have a better answer. But I could definitely give you as much information as I have, and give you what I, think the answer might be. But yeah, you are more than welcome to shoot me an email or a message on LinkedIn, and I can answer it to the best of my ability.
And students, I would definitely take Addie up on that offer. She sees resumes all the time, is at the career fairs, and she can give you that inside knowledge of what they're looking for. And kind of what Addie said to before is make sure that you're everything she says is not, this is what you have to do, right? And she's giving her personal advice. So make sure you ask everyone, our coaches here, ask recruiters and get advice from multiple people. But, and scan these QR codes, make sure you connect with her. She's offering free help.
Yes, I'm more than happy to. And yeah, definitely follow us on Instagram, Facebook, LinkedIn. Also connect with me. At every career fair, I tell everybody to shoot me a friend request too, because I love getting connected with, everybody in the community. And even if you're not looking for employment opportunities with us, um, I still want to be connected, and I was a fellow Niner. I am a fellow Niner as well. And so, yeah, but feel free to shoot me a message if you've got any questions. I'll do my best to answer them, or, ask some of my friends who might be in um, the same field you're looking at. But I can offer any help that you may need.
And also Addie being an alum, you could also reach out to her and ask her questions that, she can definitely relate to, about tips about graduating, what did you do? Looking back, what advice you might give me being in the healthcare field? Those are all really valuable questions that I think alums can really give, some feedback on. So, if you have questions about resumes, healthcare stuff, a bridge to achievement or alumni, anything like that, Addie is here to help you out. So thank you so much, Addie, today for covering this meetup topic and connecting with our students. We really appreciate it.
Very much.
Absolutely. It was my pleasure. Again, I love doing this stuff. I love getting to come back and collaborate with UNC Charlotte. I truly love UNC Charlotte, and Jessica and Brandy and everybody in the Career Center. They are just fantastic. So definitely utilize your resources on campus too, because they are extremely helpful. And yeah, so thank you so much. I had a great time, and let me know if you guys have any questions.
Thank you, Addie.
Thank you, Thank you,
Thank
Addie.
you.
Thank you,
Bye,
students, for
guys.
attending. Bye, everyone.
Thank you.